我注意到，在美国也会有一些网友甚至攻击您，说病毒是从您疫苗的这个研制过程中出来的。您在用什么样的心态面对这种声音？
I'd say it's an ironic if you take somebody who's doing their best to get the world ready and, putting, in my case, billions of dollars into these tools for infectious diseases and really trying to solve broadly infectious diseases, including those that can cause pandemics. But that, we're in a crazy situation, so there's going to be crazy rumors. I hope, whether it's individuals or countries, that in some ways this shows us how interdependent we are. That to stop a global pandemic, we need to find whoever's the best, whatever the best vaccine construct are, the best drugs, and we need to make it without just focusing on one country. We need to make it for the entire world, including for countries that don't have the resources to pay for vaccine research or vaccine factories. They're actually, in many ways, should be the priority for what we do. So, there's lots of attacks out there. In general, people have been very positive.
President Xi visited Boeing's factory in Seattle, and he also stopped at the Microsoft's campus as well as Lincoln High School. What can you tell us about these visits and, of course, his schedule on Thursday?
Now, at Microsoft, it was an interesting visit, too. A lot of high-profile tech in the tech world were there. We saw Amazon, Jeff Bezos, Tim Cook from Apple, Jack Ma from Alibaba. Sort of a who's who list of everybody in the tech world was there. Later, we thought that Mark Zuckerberg, maybe he wasn't invited to the events, but he also showed up at a sort of a meet and greet and delivered a 20-second message in Chinese to President Xi Jinping. Also, Reid Hoffman of LinkedIn and Intel's CEO Brian Krzanich all meeting. President Xi told that group that the two sides should work together based on mutual respect because of the fact that China has the world's largest internet market and U.S. has the most advanced technology, so it's a good fit to solve our problems. Mangma.
One of the things I've been most impressed by in the last week is how many members of our center are now quickly involved in COVID projects. And those COVID-19 projects span from epidemiologic surveys like we're doing, considerations of immune activation, thinking about monoclonal antibody development and potential therapeutics for COVID-19, also thinking about viral pathogenesis mechanisms. And so we've just all jumped into this in a very collaborative way, in a very quick way, which I think is quite impressive. When this novel coronavirus started to really explode in China, one of the questions we wanted to understand is why children don't seem to be getting sick from this particular virus relative to adults. So the idea behind the study that we're starting is to enroll a community cohort. In this case, we're proposing to look at the workforce in our center and their families. So what we'd like to do is enroll those subjects and understand who's becoming infected, when they're becoming infected, and who's sick from the infection.
This trial is a dose escalation trial, and that means that we are evaluating different doses in 3 different cohorts of participants. It is a trial that is expected to run from the month of March through December, and that's sort of an active phase. We are principally involved in isolating the cells and the serum and plasma samples that will be utilized in what we call the secondary objectives of this trial. So looking for whether the vaccine is inducing the types of immune responses that we think might be important for protection against this coronavirus.
You can solve the three-dimensional structure of the protein down to essentially atomic resolution. And what you'll get is you'll get a static picture of what the protein looks like.
One of the ways that you might use this for drug discovery is you look for small molecules that will fit in these little gaps or clefts in here, and you see, is this shape something that matches a small molecule that it was ideally that's already been used as a drug or drug-like for somewhere else, and then you sort of try to fit it in here computationally, and then you go into the lab and you see, well, does it really bind? And then, and this is the big if, will it actually kill the virus?
One of the things that I think sometimes is difficult for the public to understand is why would we do basic research? I mean, you know, who cares what a protein looks like? Well, the reason why we do that is so that we're ready when something like this happens. We can move very quickly, and even I've been amazed at how quickly this has moved. I mean, I've never seen a new research topic open up and get answers so quickly.